main part for the day today, why we have gathered here today, is to celebrate the silver jubilee of Dr. Pavan Kumar to be here in Mumbai. 2018, he has completed 25 years as a cardiac surgeon in Mumbai. He had not been to Mumbai ever before he came here and started practicing in 1992. He's a man who has been extremely dynamic and aggressive, and he has seen cardiac surgery growing when patients were being referred to Houston and they had to be doing the follow-ups over here. They have seen the whole era changing, how Indians used to go and stay and get their surgery done with only one person in the US. These are the people who laid the foundation. More and more patients could come here and get themselves operated down the street. Most patients don't really have any value of the change in era which these people have done. Dr. Manke, Pavan, Dr. Bhattacharya. Amazing change wherein patients don't have to travel even 10 kilometers to get their bypass surgery done. They don't have to stay to the US for such a long time. Well, Pavan has been very dynamic to give us the best kind of surgery. So, Pavan has been, again, an extremely good observer of his own surgical skills and others around. But with that, he was responsible for starting the telemedicine in Lilavati Hospital. He has been at the forefront of technology. I remember the days when telemedicine was just being talked about. He took pains to convince the management of Lilavati Hospital to give him a room wherein, when the internet connection was not 2G, 3G, 4G or no G, but I have examined patients down in remote peripheries, and he was very much responsible for that. And I still remember one day in Lilavati OT, and I'm sure all our friends would agree, with his Google Glass walking into the OT. He was one of the only surgeons who had his Google camera working. He was with technology. Even now, if you see, he would be on all social media platforms. He's extremely savvy with technology. Let me not take more time. I would call upon Pavan to give us a small talk on how his progress and journey has been in Bombay. Dr. Pavan Kumar.
Thank you, Himanshu, for giving me such a good start. Why we are here today is just because that when I joined Lilavati Hospital, 1998, 21st May, I had my first gathering here to all the consultants of Lilavati Hospital in this hotel itself. So it's a 20-year journey from there. That's why I chose this place again after 20 years, that we'll meet again here, and so that I can say thank you very much to all of you. My journey has been from Delhi to Mumbai has been a very strange one. In fact, I will say that sometime in March 1992, I got a call from Mr. Ashok Hinduja of Hinduja Hospital, trustee, for a confidential meeting with me. So I was surprised, why confidential meeting, and that too with me. I was at Escorts at that time. So I was surprised. But anyway, I went to meet him in Delhi office, and he knew exactly everything about me. What am I doing, how much surgery I have done, what kind of place I have been working, and what is my background and all that. And after talking to me, he offered me a full-time consultant in the newly opened Hinduja Hospital cardiac unit. He said, Pavan, you will never grow at Escorts because nothing grows above, under the banyan tree. And we want young surgeons like you in Mumbai, and we'll give you your own unit. I was what? I was 32 years age at that time. And it took time for me to think over. I was well settled in Escorts, which we commissioned from scratch in 1988. And now to leave that and start afresh, moving from Delhi to Mumbai was not an easy thought. But thought of having my own unit had its own charm and challenge. And I took it. So it was day 15th April 1992 when I landed in Mumbai Central Station, traveling in Rajdhani Express from New Delhi with 7 large suitcases and family of 4, wife and 2 kids. I was received by Mr. Prasad Sukthankar, the then hospital manager of Hinduja Hospital. He picked us up and put up in Hinduja guest house in Khar. While traveling on the roads of Mumbai on that day, only thing which came to my mind was that, will this city of opportunities be my new home, a workplace, or where my rest of life will be spent? Somehow, I always liked Mumbai. Its freedom to work, earn, make name for myself or anybody's. More you work, higher you earn. Of course, fear of rejection is there in my mind, as I knew nobody here, totally unknown city, no godfather for support. From protected atmosphere of Escorts Art Institute and All India Institute of Medical Sciences, to stand alone full-time consultant cardiac surgeon on retainership of 17,000 per month. And I had, when I landed here, I had 10,000 rupees in my pocket. That's it. So with that 10,000 rupees, today. So here I was sailing in a totally uncharted sea. After a few days of settling down, I did my first case of coronary bypass surgery on 28th May 1992, 2 days later from today. One Mr. Jai Vijayji Maharaj, a Jain monk. This was a referral from Dr. Parag Ajmera, my first physician, through Dr. Anil Sharma, to get my professional career started. He is a real friend of mine for 25 years. As I settled at Hinduja Hospital, I realized that professional practice in Mumbai is totally different. GPs, MDs, referrals, networking, social networking, corporate networking, all these things were new words. Then in the hospital, honorary consultants and full-timers versus. All the time fights going on between honorary and the full-timers. And then internal referrals were all new to me. Nobody knew Dr. Pavan Kumar, cardiac surgeon. Who? Who is that? And these words were often repeated by doctors and patients. When I went out to meet physicians, time and again, new words came to me. Like, he's a tiger GP in this area. He's a top MD here. He can make your career or break your career. Keep him happy whatever he asks. So I wondered from where I'll pay him from my 17,000 take-home salary. It was simply not my cup of tea. Luckily, with support of my dear colleagues like Suresh Vijan, Anil Sharma, JJ Dalal, Matthew, Ajit Menon, VK Verma, Navneet Kumar, to name a few at that time in Hinduja Hospital, who put full faith in my work so that I could start my innings well. Their support saved me from vagaries of outside world. I believed that clean image building was more important than anything else, and I still believe in it till today. I have been proven right in my 25 years of career of this belief. I believe that it is important to do first 1,000 cases right way that gets you success and sustenance. I spent good 6 years of foundation building at Hinduja Hospital as practice increased, with increasing demand from patients who did not want Hinduja Hospital for their operations. I started looking towards Lilavati Hospital while traveling from home every day. It looked very promising that maybe this hospital will be a next step. One day in April 1998, while having lunch with Mafat Kaka Mehta, you may not be knowing, but most of us know him. He's no more. At his home, who is one of his close relatives I had operated recently, he talked to me casually and about his relationship with Vijay Bhai Mehta and offered for my meeting with him. Next week, I met Vijay Bhai, our late legendary chairman of Lilavati Hospital. In meeting, Vijay Bhai told me straight away, "Tame શું કરો છો હિન્દુજામાં? અહીંયા આવી જાઓ લીલાવતીમાં." That's it. And he fixed up with Dr. Bhimani for my joining at Lilavati Hospital. Later, the then CEO, Dr. Bhimani, called me, and thus I joined Lilavati Hospital on 21st May with blessings of Vijay Bhai. Incidentally, that's where this makes 20 years of practice at Lilavati Hospital. Same time, I also joined Nanavati Hospital in same month as an honorary consultant. Freedom of honoraryship was beyond my imagination. Suddenly, there was no restriction on you from hospital, from OT booking, from charging to the patients, patient consultation. What a freedom was that, which I cherish till today. There are many offers to become full-time again, but as of now, till now, I have refused. Honorship is beyond anybody's imagination. Although I started running around with different hospitals doing CABGs like typical honorary consultant, then onwards I met so many good physicians, like you all, after I became honorary, and make good friends of them, or for life. All of them, they supported me from their heart. Initially, it was very tough at Lilavati Hospital, as I was pitted against two stalwarts, giants in their field, Dr. Nitu Manke, and Ramakant Panda. Many times my patients used to switch to them after getting admitted under me. So I remember Dr. Manke telling me one day in OT operation theatre, he was operating on one of my patients coming from Ujjain, and then he told me, Pavan, you run around so much, MP, Maharashtra, Gujarat, Africa, and bring patients here for me. And he laughed. That didn't, although it was sarcastic, but this didn't dishearten me. Those days were probably the best from 1996 to 2010, when cardiac surgeons ruled the world. Each one of us had lots of work from all over India and abroad. I made many trips in Africa, in the country, all over. Some part of Nanavati Hospital. I thoroughly enjoyed my stint at Nanavati Hospital, where ultimately I became head of the Department of Cardiovascular Surgery in 2010. I improved that department in quality and numbers. I had great support from Chairman Suresh Bhai and Priyam Bhai Jhaveri, Vice Chairman. I also set up telemedicine center there in 2005, which became largest telemedicine center in Western India, serving Maharashtra, Gujarat, UP, MP, and Africa's 54 centers. With active support from IT companies, I could develop some pioneer mobile telemedicine apps, which won many national awards and recognition. With management change there, I left Nanavati Hospital in 2016 after working over there for 18 years. I cherish these last 25 years of work in Mumbai and 20 years of Lilavati Hospital, where I practiced cardiac surgery, providing my best to thousands of cardiac patients. Year 2008, 9, 10 were very special to me, where I could provide hospital-proven 100% success to cardiac surgeries at Lilavati Hospital and at Nanavati Hospital together. All this was made possible due to great team of associate surgeons like Shirish Borkar, Dr. Bhatnagar, Dr. Saroop, Amit Modi, and many. Each of them were excellent surgeons in their own right. Anesthetists, Rajesh Hajari, Asmita Hegde, Hiten Mewada, Leena Pawar, Aditi Sawant, Namrita Kothari, and assistants Prem Jain, Dr. Purandare, and Dr. D.K. Kulkarni, and many more. Many of them got trained under me, and then now they are having their own units. They all gave their best to let me perform all complicated cases with great success throughout these years. And my two children, Aishwarya and Yashovinay, at family front. My secretaries, Geeta Farkase, Esther, Kranti, those who work tirelessly with me with full devotion. My sincere thanks to all of you, my friends, those of you who are here and those who could not come due to some reasons. I am grateful and thank you all for support. Due to your support, I could reach this milestone. Thank you all once again.